Good morning. I'm Christy Seibert. I'm the course director for the Patient, Doctor, and Society course, and I'm here this morning with Liz, one of our standardized patients. This morning we're going to demonstrate a complete physical exam for you. At the beginning of any sort of exam of a patient, as you all know, you need to wash your hands, and I've already done that. Then the first part of a complete physical exam is really general appearance. You observe the patient. Oftentimes this is done while you're taking a history, but if you're just performing a physical exam, it can be done then as well. And you observe and say, is the patient healthy appearing? Do they appear ill? Do they appear fatigued? Do they appear depressed? Or otherwise, do they look healthy and well? Then you move on to vital signs. The first thing that we typically do is height and weight. In many situations, that's already done for you. If it hasn't been done for you, you can do it yourself with scales that we have in the hallway. Then we move on to pulse. I typically start with a pulse bilaterally at both radial areas. You're trying to notice whether or not the pulse is symmetric bilaterally and also whether or not it's regular. Then typically just on one side, you can take a pulse rate. I typically do this in a 30-second time period. And then in the second 30-second time period, I actually leave my fingers on the radial pulse and watch the patient's respiratory rate. I find that this works better rather than announcing to the patient, I'm going to check your respiratory rate, because then often people will alter their respiratory rate or begin to breathe differently, and I think your respiratory rate isn't quite as accurate that way. So the first 30 seconds, take a pulse, and the second 30 seconds, observe the respiratory rate. And then, of course, you convert those to minutes by multiplying by 2. Then we're going to go ahead and do a blood pressure. Typically, this would be done in both arms. For purposes of our video, I'm just going to do it on one side this morning. Great. Typically, you do want a patient in the seated position. And you want the arms supported. So in this situation where the person is not next to a table, you'll need to support the arm yourself. And you want the brachial area to be at about the level of the heart. I generally get my stethoscope into my ears ahead of time. And you want to begin by just palpating that brachial pulse. Then you're going to blow up your cuff until that brachial pulse disappears. And then about 20 to 30 millimeters of mercury higher than that. This may be a little tight for a brief amount of time. Then just before you deflate, you want to switch over to your diaphragm of your stethoscope and deflate slowly, about 2 to 4 millimeters of mercury for every second or so. Now when you first hear the heartbeat again, that's the systolic blood pressure. And then when that heartbeat disappears, that's the diastolic blood pressure. Very good. And your blood pressure is about 118/70.